grateful to have everybody here Zooming from all over. And I just want you to know we're happy to see you, and you could choose to be anonymous if you need to, but we're happy that you're here. I want to make sure that everybody keeps their mic off. And if you have any questions, we're going to let our speakers speak first, and then you can write your questions in the chat. If you really, really want to talk yourself, just raise your hand and we'll let you speak at the end. Um, I want to say that we want to keep our questions to the information related to our talk. And please contact your own physician for any specific diagnostic and treatment questions. Um, I am Susan Lust, the co-director of the Parkinson's Wellness Project, and we are about promoting awareness, education, and social interaction for people with Parkinson's and their families. And we run educational events like this. This happens to be the last one in our series for 2021. I can't believe we've done amazing ones this year. And actually, Lori was on one of ours in the very beginning of the year. But we also have a workout program, Learn to Move, Move to Learn. We are both on Zoom and we are in our new expanded studio. So if you go to our website, hi Alita, that's great that you're here. If you go to our website, you can see all our classes. We have awesome teachers. We have Alex Tresser from PD on the Move. Yuri Milstein is our Rocksteady boxing coach, and Cecilia Fontanesi, who has a PhD in neurology, and she's a dance therapist and a contact improvisation dancer, is our teacher also. So I want to just welcome everybody today, and I'm so glad that you're with us. So this is our pwpmd lunch with our doctor, and we're devoting these last three that we're devoting to PD prevention and slowing the progression. And we can't do this without our sponsors, because they know that knowledge is power. And it is a great opportunity to be learning from our talented doctors. We are fortunate to bring you these programs to you because our sponsors understand that empowering patients with education is very valuable. And we have very talented speakers here today. So we'd like to thank our sponsors, Kaiwo Kirin, for supporting the work we do, always. They know how important the power of knowledge is to all of us. So thank you. Before we start with our first speaker, I want to introduce our guest today. We welcome them. Not only are they very talented and experienced, our two doctors here today, but something they have in common that I just want to tell everybody that I think is very important is enthusiasm. Okay? Enthusiasm is energy. And Dr. Subramanian and Dr. Mishley and Taryn Coughlin, they are all enthusiastic about what they do. And their enthusiasm is catching. And it inspires so many. So giving a person enthusiasm is giving them the key to success. So I want to introduce our enthusiastic guest. Dr. Mishley's work is focused on identifying nutritional requirements unique to individuals with neurodegenerative diseases. She has conducted research on Q10, lithium, and glutathione deficiency in the setting of Parkinson's disease. She developed the ProPD rating scale and is developing a PD screening tool, PAR-K9, using dogs to identify the scent of PD. And I would love it if her dog could show up on the screen today because I want to see that dog.
I
What's his
couldn't
name?
agree louder. We
What's
can make
his
that happen. Coco and Reed. We can
Well, it's
make
very
that happen.
Okay. She is the principal investigator of the CAMP Care and PD study, which is designed to identify the relationship between lifestyle choices and the risk of PD progression. As a naturopathic physician, she maintains a clinical practice at Seattle Integrative Medicine and conducts research in collaboration with the University of Washington and Bastyr University, and soon to publish many, many great works. Now I'd like to introduce Dr. Indu Subramanian, who I met many years ago with Lori. She received her medical degree from the University of Toronto and was a resident at the UCLA Neurology Residency Program. Dr. Subramanian received her fellowship training at UCLA in movement disorders and is currently an associate clinical professor of neurology at UCLA. She is the director of the Southwest Parkinson's Disease Research, Education, and Clinical Care Center of Excellence at the West Los Angeles VA Veterans Administration. She has an interest in integrative medicine and
I don't understand why it won't get any louder.
Okay, mute your mic. She has an interest in integrative medicine and is specifically interested in yoga and mindfulness for the PD population. She's currently doing contemplative fellowship for healthcare providers and social isolation at the New York Zen Center.
Susan, you muted.
You're muted. You're muted now.
We heard everything up to Zen Center.
Oh, thank you. I have heard Dr. Subramanian's engaging interviews with experts in the field of Parkinson's for the PMD Alliance, and I'm totally impressed with her. We're thrilled to have her here today. But before we get to the talk on slowing progression in PD and what we can do about it, I want to introduce Taryn Colin, and she's our appetizer to our lunch. Taryn looks at a person as I think that as a whole being and not as a series of symptoms that have to be treated. She focuses on nutrition, good eating practices, exercise, and mental health. And her own personal experience of transforming her health motivated her to establish the Transformational Clinic in 1998. Based in Johannesburg, South Africa, she is a functional medicine certified nutritionist and health coach. Please welcome Taryn. It's never too late to make positive changes.
Hi, everybody. We've been through a series of talks together, and I just wanted to recap, as this is the last one we're doing this year. And the things that we've discussed, well, what I'm discussing tonight actually is my heading is never too late to change or reset, and you're never too old to make changes. And I think that's very important here. And I've got a wonderful story that I'm going to tell you about a fantastic client of mine called Bill. But first of all, we have discussed everything from eating your greens, how to stabilize your blood sugar levels, eating as close to nature as possible. I discussed extensively about my green smoothie, how to get your tummy working with make my tummy work smoothie. I've shared recipes with you, and I hope you've learned something over these last couple of sessions. And so tonight, what I want to discuss with you is everyone thinks that, oh, I'm too old, I don't want to change, I like eating this, I'm not going to make any changes to my life, but I'm going to tell you something, a story about one of my clients called Bill. And Bill came to see me and he was 73 years old, and that was nearly 3.5 years ago. And he doesn't have Parkinson's, but he came to me with the most unbelievable symptoms. And what he had was severe rheumatoid arthritis. He had Hashimoto's thyroiditis, which is an autoimmune of the thyroid. He had high blood pressure. He had cholesterol, insulin. He was on diabetes tablets. He was overweight, constipated, had an abscess in his tooth. And when he arrived at my office, he took so long to get up my passageway. I was actually wondering if he was actually going to come through. And when he sat down in the chair, and I said to him, hi, and Bill, what can I do for you? And he sat down and he had tears in his eyes and he said to me, I'm so full of pain. He said, I'm so full of pain, and all I want you to do is take this pain away. And I subsequently found out that his wife had passed away, and she was overweight. She had a lot of health issues. And he had decided to move into a retirement village, and he was on his own for the first time in his life. They'd been married for many, many years, and he didn't even know how to cook. So he was living on fast food and takeout, and he kept on putting on more and more weight, and they kept on giving him more and more sugar tablets and things like that, and more pain. And so with the humor that I've got, I said, Bob, I'm going to stick you on a detox for 30 days, and we're going to clean you out, and we're going to make you a new person. And he said to me, you know something, Taryn, do it. And I said, you have to be joking. You're nowhere near doing a detox. So I started working with him, and I went over to his place because he didn't even know what a blender was. He didn't know anything about cooking. So I went over and I showed him what to do. He bought the equipment, and we started on a cleansing program, gentle cleansing program. And this man, just at 73 years old, took on this like it was his life force. And he did everything I asked him to do. And he started making my green smoothies, and we started getting his tummy working. And I started on slow exercises with him. And this man, for the full month, he did a sort of a minimal detox. And if I can tell you that this man now is 76, and he looks about 20 years younger. He has lost just on nearly 20 odd kilos. And he's off most of his tablets. His blood pressure is down. He's off his sugar tablets. He is looking so fit. He's exercising like a demon. And the only thing that he keeps on telling me is, you know something, Taryn, you know how many women are in this retirement village? There are hardly any men, and they're after me. They think I'm such a catch. And so that's the most amazing thing with this man. And I'm still in contact with him, and we do regular cleanses and things. But this man has decided at his age, at 73, to make changes. So what I want to say to you is that you're never too old, or it's never too late to make changes. And as I said last week to you guys, is that you just have to take that one step up the staircase. You don't have to run up the whole staircase. Just every single day, every single week, just make small little changes in your life. And when you open your fridge, and if it looks like a shop shelf where you've got a lot of bottles, and you've got a lot of tins, and you've got a lot of things that come out of a shop, you know you're not eating well. And if you can open your drawer and see some salad greens and some tomatoes and some cucumbers and things like that, you know you're starting to make progress. So if you could try, we've done a lot through this last couple of months, but if you could try, especially over Christmas, it's very difficult over this period of time. I know a lot of you don't celebrate Christmas, but it's holidays. And holidays seem to be a time when everybody just lets loose. Is that, please just remember what you're doing this for. What are you starting this for? And you've had so many years of eating everything you want to eat in life. You know, if you're 72 or if you're 42, just make this next year the best year that you've got. Start to just do tiny little exercises. Add a little bit of green, add a little bit of red, add a little bit of yellow onto your plate. Make sure that it's as close to the ground as possible. As we spoke about, I think it was last week or the previous week, is that start just growing a few herbs. And if you've just been recently diagnosed with Parkinson's, this is a time for you to make incredible changes. It's never too late to make those changes. As Bill says, those women are after me. And he says, I'm not up for grabs. But honestly, this man looks amazing. And if he can do it, not knowing how to cook, never having cooked in his life, his wife did absolutely everything for him, to now having hobbies and finding a purpose in life, everybody can do that. So all I'm saying is thank you very much for this time that I've had with you. Any questions, you're welcome to email me or speak to Susan. And one of the recipes that we're putting forward this week is my chicken bone broth. And it is absolutely delicious. If you know good old Jewish chicken soup, it's very similar to that. It's very easy to make. And you can always ask me for a million ideas of how to use this. But one of the things that it's great for is gut healing. And that is something that we're going to discuss next year. Is I'm going to spend a lot of time on healing the gut microbiome, and this is one place to start. And if you remember the apple delight recipe that I gave you, cooking up those cooked apples with the cinnamon and the nutmeg and the clove and the ginger, absolutely brilliant for gut healing. So I'm going to hand it over to everybody else, and I just want to say, enjoy the rest of the year, enjoy the holidays, and hope to see you next year.
Thank you so much, Taryn. Thank you, really. We need cheerleaders in our lives. We really do. I mean, we all need that push, that boost, and we all need to support each other. And that's why we're coming together. So I think that Dr. Subramanian also has that in her. And with a lot of knowledge, a lot of expertise, and a lot of years working with people with Parkinson's. So please, Dr. Subramanian, please welcome.
Thank you. So great to see everyone out there. And Lori and I work very closely together on trying to inspire our patients with positive messages and finding ways that you can empower yourself through things that you choose every day. So with that, I'll maybe show you some slides and we can talk about some of the things that I've been focusing on through the pandemic. As Susan said, I run a VA Center of Excellence here in Los Angeles, and I love working with our veterans. If any of you are veterans, thank you for your service. It's the month of November and we honor our veterans. And so, shout out to them. We also, Lori and I have an interest in integrative medicine, which is a sort of medicine that borders and sort of is the bridge between Western practices and other practices. And so I think much of what we think about when we think about health is really how to consider health in a very holistic way, even though we're treating a disease like Parkinson's, which is largely a motor disease. I think many of you will know that the non-motor aspects, including things around mental health, depression, anxiety, apathy, these things can really make a difference for how you live every day. And we hope to inspire you to consider things in your life that you can make a change around. And I've been a Parkinson's doc for about 20 years now, practiced in a very Western sort of frame of mind. And I'm really opening my mind, as I'll show you in a few of these slides, to other things that we can incorporate. So with that, I will try to share my screen and you can tell me if this is working. So I think that, hold on one second. Can you see that? Okay, perfect. So, I think that we use this word wellness in a lot of things. And I know, Susan, your organization has, this concept of wellness as well. And I think that, people don't really understand exactly what this is. So I wanted to spend a moment just sort of defining that a little bit from what my viewpoint is. And it's really this active pursuit of activities, choices, and lifestyle that leads to this holistic concept of health. And so the sense is that you as the patient, your family supporting you, you're really in control with the lifestyle choices that you make. We're not just talking about one sort of aspect of health, not just the physical aspect, but really encompassing things like mental and spiritual well-being, thinking about you and your environment, the lifestyle choices that you make. And really, I think that this definition is kind of a little bit different than what I learned in medical school. So the medical paradigm, the normal Western medical paradigm, is that you have a symptom, you complain to your doctor about it, you go in to see them, they treat you for that symptom. The sense is that it's sort of this corrective, episodic sort of treatment. Really, I, as a doctor, am responsible for your health. It's very compartmentalized. You might see me for 15 minutes once in 6 months. I wear a white coat in my office, and then you go back to your regular sort of functioning, and you might take a pill, adjust that pill a little bit. We've had Cinemet, levodopa around for almost 50 years. And that's sort of the classic paradigm that we all learned about in medical school. And I want to sort of open your mind to something different. And I think the approach that Susan has and Lori and Lauren and all of us are trying to sort of explore is really this other paradigm in which you as the patient are really trying to thrive. It's sort of finding a new meaning maybe in your life and finding ways to really improve your health holistically. Think about how we can prevent things from happening, maybe from the onset of disease, incorporating daily lifestyle choices really to make a huge difference sort of in the way that you feel about how you're living your life every day, with the hope that you're changing lifestyle patterns, finding things that you love and can really change and shape your health, and you're kind of in the driver's seat. So it's a bit different than I think the normal paradigm. So I told you that I work at the VA. The VA has actually been relatively open-minded to this concept, and they have this concept of whole health. And so you are in the middle as the patient, and there's a number of things around you that really surround you and hopefully help you thrive. And in this paradigm, there's a number of things that we've already sort of discussed a little bit. Food and drink, sleep is important in this paradigm. I'm going to teach you a little bit about social connection and why that matters. Some of the mind-body approaches, the sense that you live in surroundings or with people that love you and really need to support you. And so it's this very holistic kind of wheel of health. And it's not just really about treatment, but hopefully about prevention and really marrying some complementary approaches, some integrative approaches into the normal sort of paradigm of care. And it's not just you in your home, but really the community that you live in too, that will hopefully support this. And that includes a support group like this. So I think it's important when we're doing these talks to really think not just about the classic paradigm in which we study things in a very controlled setting, maybe in a gym, we put people on a treadmill, get their heart rate up, and then say everyone out there should do exactly what we did these studies on. What Lori and I are realizing in many of the studies that we do is that we're not really reaching a lot of the people that we hope to serve. So a lot of populations of color, for example, Black, Hispanic, Latinx populations, women are not being studied well. We're not including many people. And most of the studies that we do in our normal paradigms are really including largely white, affluent Caucasian men who may have wives that are able to bring them into the gym, really people who are affluent, who can really afford a lot of the things that many other people can't. So when we talk about, incorporating a salad with 7 colors of the rainbow, a lot of my patients at the VA just may not have access to that. So I think it's really important in 2021 to think about culturally contextualizing what we're talking about. And so for some of you who may have a Jewish faith, it might be very different than what I might talk about to a Muslim community or a Hindu community or other people. So I think really thinking about these things is important, and that you as a person, bring a lot of different aspects and layers. You might be a woman, you might have a different sexual preference, you may have a different religious background, you may live in a certain neighborhood, and all of these things can make a difference in the lifestyle choices that we can really offer you. So I think it's important to think about that. I love this First Nations perspective on health. When you think about the First Nations, this indigenous people in the US as a tribe, a lot of what they think about is their ancestors really bring value to them, the land brings value to them, the earth and the other tribes that are around them, and really thinking about all of those things when we look at this sort of concept of wellness is really important for them. And so I think that we can think about each of us and what really brings us value and joy and what makes us who we are in thinking about our concepts of health. So one of the things that I wanted to talk to you about was bringing a sense of purpose. I think that if you lack a sense of purpose, it's really hard to wake up in the morning and get going and do all the things that we try to get you to do as your doctor. So I think, everyone has hopefully a sense of purpose and what still brings them meaning and joy. And I think it's important to examine that. And it's very different for each of us. So, for some of you, it may be playing with your grandchildren. For some of you, it might be playing golf with your best friend. For some of you, it might be taking your wife out for dinner. And, these are the things that we all look forward to, and finding ways to incorporate this in your life and really bring meaning and joy to your daily functioning is really valuable for us as doctors. And I think if you can't do the things that you enjoy, then please talk to your doctor or whoever is supporting you in your healthcare about this. And I think it's important to realize that sometimes being part of a social, support group like this and having a meaning around possibly even working with Parkinson's patients or volunteering can actually be very helpful. And so I want you to think about that. And some of the advocacy work that some of the folks are doing out there is pretty amazing. So sometimes joining an organization and making a difference for others can really be hugely impactful. Another thing that I've really spent a lot of time doing some soul searching for myself is around mind-body approaches. I have a yoga teacher background. I've spent a lot of time learning about mindfulness. I think that, the mind-body approaches can be tremendously important. They don't have to be 20 minutes of meditating on a mat, though. It's important to realize that there are many sort of roots to this, and sometimes just getting out in nature, maybe gardening, maybe going for hikes, maybe doing some praying, even in a group, or singing in a choir, maybe, getting together in a synagogue, or with your friends, if for some reason social distancing has not allowed you to get in there, and perhaps meeting with people that have like minds and talking about maybe your faith can be very helpful in this approach. Journaling, thinking about gratitude, what you're grateful for, sometimes writing down 3 things that you might be grateful for. There's other things like moving meditations, Tai Chi, something, and even things like singing, dancing, playing music, art. If these bring you joy, these can also be very meditative when you get into the flow. So really thinking about what in this list may speak to you and picking something, and starting even with 5-10 minutes a day can really make a huge difference for changing things. The last thing that I wanted to speak to you about, because Lori is really going to be spending a little bit more time on nutrition and exercise, which are part of that circle. And I think we all believe in sleep as well is tremendously important, but is really the concept of social connection. This is something that I think has been so impactful in the pandemic. And, I think that Lori and I have this large database of patients, and we're looking at what can we modify in terms of variables that we can choose to try to incorporate in our day-to-day functioning. And so one of the things that we were pretty surprised about that was tremendously impactful for our patient population was actually being lonely. And it's as bad for you in populations in general to be lonely as smoking a half a pack of cigarettes a day or being obese. So we had this knowledge going into looking at our patients, but we found in our patient population with Parkinson's specifically was that being lonely was as bad for you as the beneficial effects of exercising 30 minutes a day, 7 days a week. And so if there's ways that you can make a change to incorporate maybe a social connection with exercise, you can get the double benefits of some of these sort of approaches. And these are things that you can try to pick and choose every day. So if you think about finding connection, these things can actually be pretty impactful. So I think it's important to realize that we as humans need people in our lives. We sometimes need not just our wife, sometimes it's possible to still be lonely as a couple. So looking outside the home and thinking about who are your friends circle, who are people that bring you support maybe in a common passion, like a support group or a religious group, things like that. But what we know in our research is that actually we're able to screen for loneliness. And so when you look at some of these questions, the one that we found was the most sort of helpful in our population was, do you sometimes or often feel left out? But there's a number of other things. So, I lack companionship. I feel isolated from others. I'm unhappy being so withdrawn. People are around me, but not with me. These are some things that some of our lonely patients have described, and these are on a questionnaire called the UCLA Loneliness Questionnaire. We also looked at, in the pandemic, what are the types of things that we can recommend to our patients? And these are pretty simple things that I hope each and every one of you can maybe incorporate a little bit of. If you're feeling stuck and kind of alone, these are some simple things. So just getting out of your home most days a week. So it doesn't even matter what you do. If you go out of your home, sometimes just seeing, being on the street, seeing your neighbors, seeing, a smiling face from across the street can actually be impactful and kind of a part of social connection. But other things include connecting with somebody either through the phone or a video modality. So maybe a FaceTime call or a Zoom visit with a friend. These are things that actually make a huge difference. If you can do that daily, even on the phone, that can make a difference. And then some other things. So we mentioned things like yoga and Tai Chi, online exercise classes, visiting if you can safely with friends and family. All of these things can be impactful. The last thing or two that I'll mention is that I am actually quite interested in many of these things. And there's an amazing center in your midst. I guess some of you are around the New York area. And so the New York Zen Center is a place that I'm actually doing a year-long fellowship this year. And amazing shout out to them. It's been transformational. I'm just about 3 months in, but they have a lot of offerings. And so if you have a chance to go check it out, I would highly recommend it. And then the last thing I'll say is, there's a lot of advocacy work being done in this area. And there's a book called Ending Parkinson's Disease that I think can be very inspiring, by Mike Oken and a number of my other neurology colleagues. And, there's a group called the PD Avengers that have assembled, and it's pretty easy to sign up. And they're doing, just very simple things like trying to get rid of chemicals that may cause Parkinson's. But they're actually really impactful, and sometimes just being a part of a greater sort of project, a greater good, a greater volunteerism to help your fellow Parkinson's patients can actually be hugely actually impactful, give you meaning, and help you socially connect. So I really, urge you to try to think about these few sort of bubbles that I showed you, how you can make changes every day. And I think that, many of us who've done this work really feel like part of the secret sauce to really help patients succeed is helping them to find ways to be in the driver's seat and help them with their own sort of self-agency or self-efficacy. So that's the end of my slides, and I'll pass it on to Lori.
Indu, that was fantastic. Really, that was great. And I think it sounds so simple, but it's everything that everybody needs to hear. And I am so grateful that you shared this with everybody, because we have to live like that, and it's a crazy, distracting, unfocused world that we're living in, and we need to connect with each other. What's interesting, what you said about the book at the end, is that we just had an incredible event called the Tulip Fest here in Rockland County. It was an outdoor event, and we got a suggestion to invite a county legislator. And we invited the Rockland County legislator, who's been in politics and government here for 30 years. She was a speaker at our event. I sent her that book that you just showed everybody. I sent her Ray Dorsey's book, and we're going to do a radio show with her, with Dr. Dorsey and the legislator, and we're going to start looking into the environment here, because Rockland County has a lot of issues. So it is a very important topic, and a lot of people in New York from 9/11 were very affected. So thank you for sharing all that, and everybody, you can get that book on Amazon very easily. The other thing is that you're changing over from the old way of going to your doctor and walking into the doctor's office and saying, "Doctor, how am I?" rather than the patient walking in and saying, "Hello, doctor, this is what's happening to me." So I think that whole mindset is such a great shift, and everybody is, I think, in the process of changing. So without any further ado, Dr. Lori Mishley, woohoo! I'm so glad that you're with us today, and thank you for bringing Dr. Subramanian with you.
My pleasure. It's fabulous to be invited back. So before I dive into any of the slides that I brought, I just want to introduce a couple topics that I think get muddied as we start talking about how to improve our lives with Parkinson's disease. Those of you who have heard me speak, I'm sorry if I'm those of you who have heard me speak before, I'm sorry if I'm belaboring this point, but I think it is so absolutely essential that you all understand the difference between symptom management and disease progression. Because there are a lot of things that we are talking about here today: changing your diet, reaching out to more friends, getting a little more physical activity. You may wake up tomorrow or the next day and say, "Yeah, no, it's not working. I don't feel better." It is not like levodopa, where you pop a pill and the Tin Man gets oiled and all of a sudden you can move a half hour later. There are medicines that improve symptoms, but might actually accelerate progression. There are things that slow progression, but don't do diddly squat for symptoms. They may even worsen symptoms. We are looking for something that improves symptoms and slows progression. But in the meantime, we might just have to settle for dopaminergic therapies for the symptom management, and exercise and social health and diet for the disease progression. And together they're a nice package. But I draw that distinction because I think some people go into lifestyle modification with unrealistic expectations. And none of the advice that we are giving you here today is frankly to make you feel better right now. It is like investing in your retirement account. I mean, we are talking disease modification by slope. So as an epidemiologist, epidemiology means the study of populations. And historically, what most epidemiologists have done is study who is likely to get disease. People with high blood pressure are more likely to have a stroke. People with high cholesterol are more likely to have heart attacks. Oh, we're screen sharing somebody's.
That's
not me, right?
no.
Okay, sorry.
Mhm.
But historically, the study of epidemiology ends with diagnosis. These are the things that are associated with Parkinson's disease, getting a diagnosis of Parkinson's. We know that pesticide exposure increases your risk of Parkinson's. We know that skin cancer increases your risk of later being diagnosed with Parkinson's. We know 6 studies say the more dairy you eat, the more likely you are to get a diagnosis of Parkinson's. What we didn't know, what we don't know, is from the point of diagnosis forward, are there things that you can do that will impact your outcomes? You might not appreciate their benefits for another 5, 10, 15, 20 years, but are there seeds that you can plant now that will change outcomes over time? So the relevance of that is, if you are 98 years old listening to this talk right now, I would go live it up. I would drive fast and eat whatever you want. And if you don't like exercise, don't exercise, right? Because actually, these things are actually going to all improve your quality of life anyway. And being
Hey,
a little
don't
bit
tell
funny.
that to my mother. Don't tell that to my mother.
I'm being
Listening. I want her to exercise.
I'm being a little funny, but
didn't
the
hear that.
point is, the longer you plan on living with this condition, the more you need to get yourself in gear, because the decisions you make today, you will be living with those consequences in 5, 10, 15, 20 years. And in 5, 10, 15, 20 years, you will really be kicking yourself for the things you're not doing today, right? So my goal is to get all of you to 100 years old in really good shape. So about 8 years ago, I started a study to answer the question, are there things that people can do now that will affect the rate of progression over time? Not disease symptoms, but to decrease progression over time. So I'm just going to show you a couple slides. This is not a big fancy slideshow. I just want to kind of show you what we're talking about. So by the time you get a diagnosis of Parkinson's disease, you've probably already had this disease 5, 10, 20 years, right? The diagnosis occurs actually fairly late into the disease. This dotted line down the center that I'm pointing to is where diagnosis happens. So all of you who have a diagnosis, we're already in this zone here. And what we want to know is, can we improve these outcomes? Can we stop the progression from happening? Those of you who ask questions about prevention, absolutely. Primary care physicians should be screening for loss of smell. You should be asking your kids if they talk in their sleep and act out their dreams. You should be asking their kids if they're constipated. I mean, there are a lot of things early in the disease that I think as a community we are missing. And there are opportunities for prevention, especially if the interventions are things like exercise with your friends more often and eat more tapas. Right? Like there are easy changes we can make that really do count towards disease modification efforts. So what I am looking for are things that the black line through the center shows what the true honest rate of progression looks like in today's standard of care. Statistically, the average person gets about 10 good years before they say their quality of life is no longer excellent or good, it's starting to be fair. Right around year 10, people say this stinks. Right? But the first 10 years for most people, quality of life is actually quite good. All of these green dots are real people. There are people who are thriving 20 and 30 years after diagnosis. We now have a lot more people in this study. We have 2,800 people in this study now, and there are people who are doing incredibly well decades after diagnosis. I am studying who are those people and what are they doing differently than everybody else. One of the big findings is exercise. Dr. Subramanian just showed progression data. The data that she showed was actually adjusting for years since diagnosis. The data she showed that said, 5 days a week of exercise was better than 4, 6 was better than 5, 7 was better than 6. Those data actually suggest the more exercise you do, the slower the progression. These data have to do with symptoms. When we looked at all of the people who answered the survey questionnaire and we mapped out their symptoms, the wider out on this radar chart, the larger the spider web, the more symptomatic a person was. And what we could see, the non-motor symptoms are on the right, the motor symptoms are over on the left. But what we could see is that the first 2 days of exercise each week don't actually do much to decrease symptoms. Or people who are, 2 days a week of exercise is not associated with reduced Parkinson's symptoms. The gray line are people who are doing 3 to 5 days a week for at least 30 minutes. And the yellow line are people who reported doing 6 to 7 days a week of exercise. It takes 3 days a week to kick it into gear. And then the results seem to get better the more you do. Our advice is make it a part of your daily routine. It's not the end of the world if you miss a day. You're not in the mood, you get busy, fine. You're not going to make every day, but I want this to be as routine in your life as brushing your teeth and eating breakfast. Every day, no matter what, you do something that counts as that you can check off the box. I did 30 minutes of exercise today. I don't care if it's Tai Chi or yoga or a walk or pickleball or dance classes. It can be anything you want it to be, but 30 minutes a day, every day. Can you think of a cheaper, easier way to reduce symptoms by 50%? Motor and non-motor. And when you really start to look at this, it's amazing. Urinary symptoms, the difference is huge. You would never think that the reason I'm having all these urinary problems is probably because I'm not exercising enough. But our data suggests that the people who are doing the most exercise do not have nearly the same number of urinary symptoms. So we don't know entirely what's cause and effect. We're working to kind of tease that out and figure that out. But I'm trying to give you easy ways to have fewer symptoms. What should I eat? My PhD is in nutrition science. That was really one of the reasons I got into this study in the first place, was to answer the question, are there foods that people are eating that are associated with faster or slower progression? The cross-sectional research, these data are just taking a slice. We're still adjusting for years since diagnosis and income and education and all of that. But we can tell you with 95% confidence, when we just take a slice of our data set, the people who are doing the best are eating the most fresh vegetables, drinking wine, especially red wine, fresh fruit, nuts and seeds, olive oil, coconut oil, fresh herbs, eating eggs, spices, and soy. When we follow people over time and we look at, does changing your diet result in change in symptom progression? Look, it's pretty similar. Fresh vegetables, wine, fresh fruit, nuts and seeds, green tea is on this list. Coffee is on this list. Fresh herbs, oatmeal is on this list. We are really struggling with what does it take to become a part of the package? Like, what does the Parkinson's disease diet look like? We now have data. We can tell you with 95% confidence that the people who are doing the best are eating the most things on this upper package. What we don't know is how to package that and deliver that information to you in a way that, we don't know how to package and deliver it. Same thing, we can see the foods associated with faster progression. When we take people just like you, your gender, your income bracket, your age, who were diagnosed the same time as you, the people with the fastest progression are drinking the most soda, especially diet soda, eating a lot of ice cream. They're eating canned fruits, beef, chicken, soda, I already said, fried foods, cream, eating out of cans, drinking out of plastic bottles, yogurt, milk, butter, juice, pork, frozen vegetables, canned vegetables, and cheese are pretty much coming up on all of the same list. And it's kind of interesting. The foods that are associated with most likely to get a diagnosis of Parkinson's or most likely to prevent a diagnosis of Parkinson's line up pretty beautifully with the same foods that are associated with faster and slower progression, which I interpret to mean until we have a cure, it would be foolish to continue eating these foods and not fill yourself up with these foods. And I would recommend the same thing for your children, for your neighbors, for your friends who have not yet been diagnosed. There are millions of people walking around right now who already have Parkinson's disease, but they won't know it until they develop a characteristic tremor in a couple of years, right? This same diet is associated with reduced incidence of Alzheimer's, cancer, heart disease. This isn't that different than all of the Mediterranean diet. Oh, that's my next slide. So in terms of the packaging and delivery, you know, I'm working on, you know, you should see, I have so much fun with myself here. I'm like trying to grocery bags that have, you know, the list of good foods on them. I am trying so many ways to communicate what it is that you should be putting in your body as fuel. And I don't know why. The nature of this research does not allow me to explain to you, what about goat milk? What about organic? But my milk is non-pasteurized. I mean, I don't know. All I can tell you are the people who are doing the best are eating the stuff in green. The bigger the font, the more impact it had.
Her name, Laura.
And then because people always, you know, say, well, I'm not giving up my X, Y, or Z. I'm going to follow the Mediterranean diet. What I've done here there have been 4 diets now that have been published to have something possibly to offer people with Parkinson's. The ketogenic diet was a very small study. It was not powered for efficacy in any way, but it did show an improvement in non-motor symptoms after a very short amount of time. I usually don't recommend that diet, but there have been several publications on both the MIND diet and the Mediterranean diet as having maybe beneficial for people with Parkinson's. And then I'm calling the diet that we just talked about here today, based on patient-reported outcomes, the Parkinson's Pro diet, because it's based on patient-reported outcomes. But you can see there's a tremendous amount of overlap pretty much across the board. You know, we're all kind of finding independently the same amount of foods. And it's not that the MIND diet doesn't think you should eat spices. The study just didn't ask.
I am.
You know, so we don't know how important it is to cook at home or buy organic. I'm the only person to date who's put that on their survey. It might be a goose chase. It might be irrelevant and not important. It might be that it's just been an neglected question in other studies. So across the board, we see red meat, pork, chicken, dairy. I'll say for most of them, fried food, soda. You know, these are the themes that we're finding, and I'm certainly open to suggestions. I'll certainly take questions, but this is as good as I have been able to do in my 10 to 20 year quest to answer the question, are there things people can consume that slow the rate of Parkinson's disease progression? For those of you who are in this study, thank you. You have made this research possible. For those of you who are not yet in this study, it was previously called the CAM Care study. It's been rebranded because it has now grown to include pharmaceuticals and exercise and social connection and you know, a whole bunch of questions. So you can just hit the button, join the study here and begin. You can get your questions answered about what is this study, how are we doing it? But anything you need, you can contact me or this study through this website. And the more people who join, the more updates we'll have for you and the more accurately they will reflect you.
Dr. Mishley, that's terrific. You know what I think is, it connects to what Dr. Subramanian was talking about, is that we all need to help each other and find our purpose. And this is something that everybody could help you bring this out into the world. So when you're sitting home, hopefully not alone, you'll be able to get involved with your study. And I think that's a way of giving back. I really do. So whatever information they need to do to work with you on that, can you just type it into the chat?
Yep.
And yeah. We do have some questions. So let's see. The first one, do fruits and vegetables need to be organic?
No. The way that I phrase the question on the survey is true or false. I try to eat organically grown foods when possible. All I want you to do is answer true to that statement. Okay. If you try and you do it where possible, there's a list online called the Dirty Dozen by the Environmental Working Group, and every year they update it. And you know, it'll say 1 year, hey, there were no pests on the blueberry fields, and so there was no need to spray pesticides this year. So the conventional blueberries are virtually the same as the organic blueberries, so don't worry about it. Bananas have a thick skin, don't worry about it. But then they'll say strawberries and lettuce, if you can't get organic, don't buy them because they are so heavily sprayed. And that list changes year to year. So if you just Google the Dirty Dozen, that will tell you what
Yeah.
Which,
I
which
just
ones
was
do
eating
you
an
do?
orange the other day and the oranges came on their list. So I was like, okay, now we got to find organic oranges.
Yep.
Thick skin, talking about thick skin. Another question. Wait, does wine interfere with medication or can we just like have 1, 2, 3 glasses? How many glasses of red wine are we talking
It
about?
depends on the medicine. Selegiline is probably the one we have to worry about the most. But if you have something different to say, I tell people a glass of wine with other meds is
Yeah,
typically no
I
problem.
don't think, I mean, I think that one has to be careful with alcohol consumption, just if you have, balance issues or cognitive issues, probably, we don't want to, have people using alcohol as a treatment for anxiety or other, sorts or to calm down their tremor. But, I think, a glass of wine with a meal is fine if you can tolerate that. If
Yeah.
you enjoy it, we definitely are not avoiding it. And with selegiline or rasagiline, I think, the amount of alcohol that you'd have to consume to really get to those levels of interaction with the drug is pretty high. So I'm not too worried about that.
Okay. All right, good. Where does fish fit in?
Fish fell off the list. It's neutral, but it has been on the list of beneficial foods to consume for the last 6-7 years. And this year, as more people have joined the study, it does not seem to be making a big impact in slowing progression. It's not hurting, but it is no longer associated with slowing progression.
Mhm. All right, I have some, let's see, I have some other questions that we received. How can we catch the signs of Parkinson's when so many people have mild symptoms for years without the doctors picking up on it because there's no real test?
So we are getting better at it, I think. I think movement disorder docs are getting better at identifying. There are smell tests that you can actually do and be scored. If you have REM sleep behavior disorder, if you have constipation, if you were to see somebody who is well trained and what to look for, I do believe that we are getting better at saying this, calling something prodromal Parkinson's. The Movement Disorder Society now has a prodromal risk calculator. A study just came out last week from Italy showing the higher somebody's blood glutathione level, the less likely they were to move up on the Parkinson's prodromal risk calculator. So we are now not only doing studies on Parkinson's progression, we are actually starting to get at some of prodromal time. There are skin biopsies. There are 2 of us that are training dogs. Someone asked,
I can't.
Oh, who is that?
this is Reese. This is our medical detection device, number 2. But so, we're training her to smell. She can go up and down a track like they do at the airport sniffing luggage and smell your dirty Q-tip and scratch, will paw at the ones that have the scent of Parkinsonism. So we're doing a study right now called the Parkinson's Precision Project, where we're documenting the sensitivity and specificity of that in hopes that we will have screening tests. There are skin biopsies. I just had my first patient come in. Her only complaint was she had a positive skin biopsy test. A primary care doctor suspected she had some early symptoms, sent her, and came back for what looks like maybe Parkinson's. So more and more there are tools coming, and I predict in the next 4 years, 5 years, we will be regularly screening people more often. It's a missed opportunity to intervene early.
Okay, what about our families? If my brother has Parkinson's, I have Parkinson's. What about my children? How would I test with the dog? Would I do those skin biopsies on them when they're older children, like in their 20s or 30s?
None of that's available right now, but it is all coming around the corner. And personally, my ask is that MVP study link that I put up there to join the study. We just got approval from our ethics board about 6 weeks ago that we are now studying people who don't have Parkinson's also. And so the best thing they can do, if there is even an inkling, like, I'm great, except I've always been constipated. I'm fabulous, except I act out my dreams in my sleep, and that makes me a little nervous. I have 3 family members. Any of those things that make someone a little nervous, I would ask them to please consider joining this MVP study so that we can begin to study not just how to slow Parkinson's prevention, but expand our study to include how can we better prevent Parkinson's diagnosis.
Can I ask a question?
Sure, Rhonda.
Okay.
Yes.
Okay, thank you. Okay, so I'm calling from New York, upstate New York, and in about 2 months, my husband and I are moving out to Seattle. He has Parkinson's, been diagnosed about 7, 8 years. So we're looking for doctors out in Seattle now. Our daughter is a pediatric neurologist in Seattle. Possibly you know her, I don't know, Dr. Lauren Plonner. No, but so could we contact you when we get out there?
Sure, I'll put my clinic email on there, and I'll tell you who all my favorite movement disorder docs are in town and help you get connected.
Oh, thank you so much.
All right. And great.
Susan, I have a question,
Connection. Yes.
if I may. Hi, this is Helene. My question is, Dr. Mishley was talking about milk products. I had been on another webinar where another specialist in nutrition was discussing that people with Parkinson's should not have food with milk products, for example, yogurt that has whole milk in it, or cheeses. I can't think of other, or ice cream. Could Dr. Mishley discuss the milk products in food that, as far as relationship to Parkinson's disease, and why we should not have it?
She mentioned.
Because I forgot why the other person said we should not.
Probably their answer is probably the same as mine. I mean, we don't know. There are all kinds of theories about pesticides, GI inflammation, lactose intolerance, introducing the wrong microbiome, decreasing uric acid levels. There are tons of theories floating around, but nobody knows. All we know is there have been 6 studies done around the world that have asked, is there something in our environment that could be causing or contributing to Parkinson's disease? And all 6 of them have independently identified dairy. The more dairy a person consumes, the greater the risk of being diagnosed with Parkinson's. And then separately, I looked at people who were already diagnosed and said, is there anything people are eating that is making progression worse? And independently, butter, yogurt, cheese, milk, cream, and ice cream have all been identified as associated with worse outcomes. You can do, so the reason we are telling you to minimize or avoid dairy is because the evidence says the more dairy you eat, the worse off people are, symptomatically and progression wise. But we can't tell you why. We're all guessing.
Right.
This
I have
has
seen
been completely inspirational. I have to thank everybody, really. I think that Dr. Subramanian, Dr. Mishley, Taryn, I'm inspired by you all. And I see that everybody here is also. I know we could go on and on, but time is of the essence. And I know everybody has to get to their main jobs. So I want to thank Dr. Subramanian. I want to thank Dr. Mishley, and I want to thank Taryn Colin. And everybody should take their information and stay tuned for all our great webinars that are coming up in 2022. All right. Please stay in touch, everybody, and stay
Thank you.
connected. Stay
Thank you.
connected.
Thank you.
Everyone.
Bye.
Good job, Susan.
Thank you very much. Bye.
Thanks, everybody.